Hey guys, welcome back. If you're new here, my name is Michelle. I'm a registered nurse in Canada. And in this video, I just want to thank you guys so much for 20K on Bilibili. 真的非常感谢大家的支持。因此呢，为了表示我的感谢，在这个视频中，我将回答我经常收到的一个问题，那就是在加拿大如何看病或者如何看医生。那么为了更好的回答这个问题，在这个视频的第一部分中，我将解释如何在社区，例如诊所看病。然后在第二个部分中，我将解释如何在医院看病。那么接下来我将用英文解释，因为我的英文解释的比较容易。所以呢 in part 1, so how to seek medical attention in the community. So for example, a clinic. Now, where I am in Canada, if you're trying to see a doctor in the community, there are two ways to go about this. So the first way is to go to a walk-in clinic. Now, with a walk-in clinic, no appointment is necessary. You just walk into the clinic. And then you tell the person at the front desk, who is usually a nurse, that you would like to see a doctor. And then the nurse will ask you why you're there. So for example, what your medical concern is, and then collect some of your information, like your healthcare card number. And then the nurse will ask you to take a seat in the waiting area until the doctor is ready to see you. And when the doctor is ready to see you, the nurse will call out your name. And then she'll lead you to a room where the doctor will show up a little bit later to examine you. Now, while you're in the room, the nurse will probably take your vital signs. So for example, she might take your blood pressure, your temperature, and so on, depending on what your concern is. Then you'll just sit there and wait for the doctor. Now, method number 2 is you go see your family doctor. Now, if you want to find a family physician, you would first call the clinic where the doctor works to make an initial appointment. So for a lot of doctors, before they accept the patient, they require an in-person sort of meet and greet initial appointment to see if they want to accept the patient as their own. Now, once you've scheduled the initial appointment, you meet your doctor and they accept you as their patient, then you can schedule future appointments with that same doctor every time. Now, this doctor is the most responsible for your care. And if you want your family physician to take care of other members of your family, so for example, your spouse or your children, then you would have to ask your doctor if they are able to accept your family members as their patients. And you have to ask this because family physicians do not automatically assume the care of your family members, even though they are called family physicians. Now, during your medical visit, your doctor may, number 1, recommend a treatment plan. So for example, your doctor recommends that you start a special diet, an exercise program, and a new medication regimen for your heart disease. Your doctor may then schedule a follow-up appointment, so for example, in 2 weeks to check on your progress. And you make this follow-up appointment with the nurse at the front desk before you leave the clinic. The doctor may also prescribe medications. So some doctors' offices will fax the prescriptions directly to your preferred pharmacy in order to fill your medications. And then you can just go to the pharmacy and pick up your medications. Now, other doctors' offices will give you the prescription and you'll have to go yourself to the pharmacy, give the pharmacist the prescription, wait for them to fill it, and then go pick up your meds at a later time. So it really depends on the doctor's office, so make sure you clarify whether your doctor will fax a prescription to the pharmacy or you have to bring it to the pharmacy yourself. And again, your doctor may schedule a follow-up appointment to check on your progress. Your doctor may also order a lab test. So the doctor will usually print off a lab requisition or a lab rec. And you take this form along with your ID and your healthcare card to the lab that's written on your lab rec in order to do the test. And after you do the test, the results are automatically sent to your doctor. Now, most doctors only call the patient if the results are abnormal. And number 4, the doctor may also refer you to another doctor in the community or in the hospital. So for example, your family physician may refer you to a dermatologist in the community, or they may refer you to an oncologist in a hospital. And when a referral is made by the first doctor to the second doctor, usually you'll be contacted by the second doctor to make an appointment. And for all appointments, you show up, you wait in the waiting room, and they'll call you in, just like I described earlier. Now, part 2, how to seek in-hospital medical attention. There are 2 ways to go about this. So the first way is, if it's an emergency, you go to the ER, that just stands for the emergency room. In the emergency department, there's a nurse called the triage nurse who will be the first person you talk to about your medical concerns. If you're able to, you line up in the triage line, and once it's your turn, you tell the triage nurse what's wrong. And the triage nurse will ask for your healthcare number, take your vital signs, and also conduct a quick assessment on you. So for example, you come into the ER with an open laceration in your foot, but you can still stand and it's not too serious, so you could just wait in the triage line. Now, when it's your turn, the triage nurse will ask for your healthcare number, take your vital signs, and also assess the wound. The nurse may also put bandages over your wound and give you some instructions before sending you to the waiting room. So you wait in the waiting area, and then another nurse will come out and call your name when it's your turn to be seen by the doctor. Now, if your concern is very, very urgent, then just call 911. An ambulance will take you to the ER. Now, the second way you may receive in-hospital medical care is if a doctor makes a referral to another doctor in the hospital. So for example, your family doctor refers you to a cardiologist in the hospital. Now, when a referral is made by the first doctor to the second doctor, usually you'll be contacted by the second doctor to make an appointment. And again, for all appointments, you show up, you wait in the waiting room, and they'll call you in when the doctor is ready to see you. Alright guys, that's it for today. Hopefully you guys found it helpful, and thanks again for your support, and I'll see you in my next video. Thanks again. Bye!